Hello, I'm Colin Primrose. I'm a radiology registrar based in Glasgow, Scotland, and this is a showcase presentation on pitfalls and artifacts in contrast-enhanced MRA. So certain artifacts that are pertinent to contrast-enhanced MRA, and they're mostly to do with timing, post-processing, and magnetic susceptibility. So we'll talk through a few of these. The first one to discuss is regarding timing. This is ringing, or Maki artifact. So the filling of K-space should be coordinated with the administration of contrast. But if the filling of K-space happens too early, where there's a rapid rise in gadolinium concentration, this can result in ringing artifact. And this is what this looks like. There's an example of a carotid angiogram. However, we're looking at the jugular veins here, and we can see that there's alternating bright and dark lines. And this is ringing. There's an axial slice here that shows the presence of those bright and dark lines in the jugular veins. Conversely, if we acquire too late, we may have venous contamination. And this can make accurate interpretation of the artery slightly difficult. This is most problematic in regions where there's rapid arteriovenous transit in the kidneys or intracranial circulation, or in the lower limbs where there might be cellulitis. So there's an example of severe venous overlay in the lower limbs. So there's certain ways this could be ameliorated, and meticulous technique and practice using a test bolus or fluoroscopic triggering can help with that, using elliptic centric K-space ordering. Also, time-resolved imaging can help, where you've got several time points and you can choose the best phase to be selected later on. This is an example of an aortic iliac angiogram which is acquired too early and salvaged using time-resolved imaging. So there's an artifact where there may appear to be focal stenosis of the subclavian artery on the same side that there was a venous injection of the contrast media. And this is caused by high concentrations of gadolinium, causing susceptibility with T2 star effects. So concentration of gadolinium in the bloodstream increases the T1 signal intensity up to a certain point, but then after that point, T2 star effects predominate. And that's the cause of this pseudostenosis. So the resulting angiogram may appear to show a severe stenosis of the left subclavian artery. However, this is just a result of the T2 star effects causing signal loss from the concentrated gadolinium chelate contrast. Next one to discuss is metal artifact. Every MR sequence is susceptible to artifacts from metal to some extent, but we need to contend with these endovascular stents. And depending on what stent has been used depends on the magnetic field disturbances. And knowing the past medical history can avoid misinterpretation regarding this. There's lots of artifacts regarding subtraction. The point of subtraction is to remove high signal from fat, and this maximum intensity projection appears to show a severe stenosis in the crural vessels, but it's actually just a result of the patient moving between the unsubtracted and subtracted image. Alternative to subtraction is using a T1 weighted fat suppression technique called Dixon, where a chemical shift technique uses echoes from two or more separate TEs to separate water and fat. Dixon methods are generally more reliable than other fat suppression techniques and generally allow MRA without subtraction. However, there are further pitfalls with this technique. Maximum intensity projections are an excellent way of gaining an overview in anatomy and physiology. However, there are certain other pitfalls. This MIP appears to show occlusions of both proximal femoral arteries. However, when we look at the base images, it shows that the scan is poorly planned, with the left and right superficial femoral arteries at the edge of the field. Sagittal reconstructions show that the field of view has been angled posteriorly and should have been angled anteriorly. So this has been a brief whistle-stop tour on artifacts in contrast-enhanced MRA. I'd like to acknowledge Christopher Francois, Jeff Maki, Charles Dumoulin, Elizabeth Heck, Giles Raditi, Kevin DeMarco, and Peter Douglas. Thanks.